Yeah. So I'll just show you a small case and we'll continue. If you don't mind, can you please close the door? Okay. See now, I know for a first year student, this might be a little difficult to understand. I'm not asking you what the diagnosis is. Okay. But I just want you to understand the picture, I want you to understand the area. Okay. From anatomy, from physio knowledge, what exactly you get to know looking at this particular area. It is a lesion. Which part, which organ? Leg, very good. Leg is a part. And you see the skin getting affected. So what you see here is the skin continuity is lost. Okay. You will study a little later. This is what we call it as an ulcer. Ulcer. Okay. So this was a case of a venous ulcer which had come to our OPD few weeks back. Just quickly go through the images. Dr. Venkataraman, one of our PG, he had taken the case and we had worked the case together and a remedy was prescribed. And after a few days of a remedy, can you appreciate the change? To appreciate the change, you should remember this particular image. Okay? So, after a few days of treatment, if you can just see the upper ulcer, is completely gone and slowly the lower ones are also reducing. Okay. Now this is after a homeopathic remedy. Now what is that homeopathic remedy that was prescribed to this gentleman is what we are trying to understand. And must be at the end of the class, it's a very lengthy remedy, it's a very important remedy. We may take 3 to 4 hours to complete this particular remedy. So the 3 to 4 hours will be divided into few parts, 45 minutes, 50 minutes, of 3 or 4 classes. Okay. So at the end of the class, I will tell you what is this remedy that we prescribe and how this remedy helped this patient recover is what we are trying to understand. See now this is something, as a small revision. We have already done a few homeopathic remedies. Done? So as a small, recall, I just wanted to ask you what are all the remedies that are prepared from plant, from what we have done in term 1. So we have done very good. We have ruta, arnica, symphytum, calendula, testox, Bolivia, hypericum, beautiful, good. So many remedies, very good. Any remedy prepared from animal source? Okay, though it is not yet done, we also have some remedies prepared from animals. Okay, and important is we also have another source. The source is minerals, and we have discussed 1 or 2 remedies belonging to the minerals. Like for example, in terms of very good, beautiful, good, we spoke of Cilicia, Vijaykrishna, and we also spoke of calcium. Correct. And today we will be discussing one more remedy which belongs to the mineral group. From the image, you know that this is the border, and I was also trying to tell you a few days back, many students from rural background, you know that this is something that is used in firework, crackers, good, crackers, okay? So, sulphur is something that is used in firework, okay, crackers, manufacturing of crackers. So what I was trying to tell you is, or what I want to discuss in the next few minutes is, the first objective is, we will be looking at the sphere of action and pathogenesis of sulphur. That will be my first objective. Then we will be listing the ailments of sulphur and, very important, how sulphur looks. See, when I told you sulphur is a remedy, we will be, discussing for almost 4 hours. You know how much symptoms sulphur has. That your teacher will be discussing this remedy for almost 4 hours. So, indirectly, what is the clue you get? Beautiful, very good. I am happy with the word. I am terms of sulfur. So 4 objectives for today's class, and hope the objectives are clear. Sulfur is the remedy I am going to discuss, and this being a CBDC class, every point can turn into a MCQ. Okay? So brimstone, flowers of sulfur, sublimed sulfur are 3 common names of sulfur. Okay? And this can also be MCQ. Sulfur belongs to animal, mineral, plant, imported layer. Can be MCQ. And how is sulfur prepared? It is prepared by titration. And very important is the person who proved sulfur is the founder, Dr. Hahnemann. So these are the preliminary informations which can be a MCQ. Okay. Now, little information taken from Dr. Fontax Materia Medica. Sulfur is a product of volcanic eruptions, found free in nature, and was used from remote times. You understand? Though it was Dr. Hahnemann who introduced sulfur to homeopathy, sulfur as a medicine was used before Dr. Hahnemann introduced sulfur into homeopathy. So he says it was used mainly for skin affections, therefore it is a great antisoric remedy. Don't worry about antisoric right now, we'll discuss later. Now important, any polyglus, any defect in remedy, this area is very, very important. You understand sphere of action? Half of the remedy will be clear. Especially when you are looking at particulars, half of the remedy will be clear. So we'll quickly look at the first area. What is the first area? Venus. I was trying to tell you in the last class. As an anatomy student, blue denotes vein, red denotes arteries, yellow denotes nerves. Right? So these are the basic things you need to remember. Right? So it is a remedy which predominantly acts on the veins, the venous system. The veins, and it causes congestion. It causes congestion. Now what is congestion? We discussed again in the previous class, sudden rushing of blood, congestion. I'll explain this a little later. See, veins in general are, there is something in particular, you see sulfur acting. And again, knowledge of anatomy, what is this? Okay, good, very good. Happy with digestive system, but there's something beyond digestive, portal system. So as a small assignment, boys, girls, go home, read portal system so that you also understand sulfur better. So acting on the veins, acting on the portal system, this causes congestion. I've given you an image taken from Google. Now what is this? Hemorrhoids. So again, correlating anatomy. Normal rectal veins. Please have an image of normal rectal veins, and in sulfur, the normal rectal veins, they go into congestion. And this is the result. The rectal veins becomes engorged, swollen, and this is what we commonly call it as hemorrhoids, or it is also called as piles. In our local language, we call it as piles. But medically, the word you need to use here is hemorrhoids. Okay? And again, a very good remedy for constipation. So chronic congestion, hemorrhoids and constipation is what sulfur does acting on the portal system. So this slide, a very important slide. 2 outcomes of this slide. First thing is, it is acting on veins in general, any vein. And what is the action? Congestion. Good. Second, I have spoken of a specific area, and that area is portal system or portal veins, and it is causing congestion, which leads to either constipation or it can give rise to hemorrhage. Now, from blue, you see that. So it's also a very important remedy acting on the heart. Okay. Not only heart, you also see this acting on the lymphatics, green lymphatics. Okay. So irregular distribution of circulation action of sulfur on the circulatory system. Physiology, circulatory system. So this remedy sulfur is acting on the circulatory system and it is causing irregular distribution of circulation. See, tomorrow when I tell you sulfur has warm arms, okay, sulfur has red lips, sulfur has warm ears. All these things will be because of its action on the circulation causing irregular distribution of circulation. I'll share a small case. Very recently we had this girl. I'll share two small cases here. We had two cases. One was a small girl. She had a bad cough. She went to my wife, got treated. She was not better. She came to me. I gave some medicines. She's not better. Again, she went back to my wife. And one beautiful symptom my wife could elicit was this girl had red lips. Okay, she's not come with lipstick and all. She's sick for 4-5 days. Small girl, 5 years, 4.5 years old girl. Lips are comparatively red. Okay, and the symptoms also match sulfur or cough symptoms. And after sulfur, her cough reduced. So now this is what you need to understand. I'll be talking to you more in detail after some time. Sulfur generally will have red lips. It looks as if they have applied the lipstick. Red lips. Okay. Sulfur will have red ears. Sulfur palms may be very, very hot. And one more case of another boy who was down with fever for so many days. Lot of homeopathic medicines given, nothing helped. And in this boy again, the beautiful indication was warm arms, warm soles, and lips were unusually red. Okay, Kempaturi, with fever. That can be an indication of sulfur. Okay, so tomorrow, see, when you start reading sulfur, sulfur has red lips, sulfur has hot palms, soles. It's all because of this irregular circulation, congestion. All these things can bring in heat, redness. Okay? Another remedy you should remember here, acting on the lymphatics. Which is the remedy? Which is the other remedy which acts on the lymphatics causing acrid excoriating discharges? Very good. One remedy is Alicia. Second remedy? Barretta. You should also add sulfur. Okay? So acrid excoriating discharges on the lymphatics. Beautiful remedy from what we also learned from Dr. Fatak's line. Not only now, before Hahnemann introduced sulfur into homeopathy, sulfur was used as a skin remedy. So beautiful remedy acting on skin. And you name any disease, sulfur is capable of producing and sulfur is capable of curing. Okay? Vesicular, pustular, itching, I'll explain in detail. Now second very important thing here is what is this? You have remedies which have been already told. This is pleura. What is it? Serous membrane. We have mucous membrane, we have serous membrane. Knowledge of anatomy, please apply serous membrane. Which is the other remedy from your list which acts on the serous membrane? Very good, beautiful, good. Bryonia. What is the action of bryonia on serous membrane? What is it? I heard the word right. Diffusion. Acting on the mucous membrane, bryonia causes dryness. Good, dryness. Acting on the serous membrane, bryonia will cause accumulation of fluid. What we call it as effusion. Pleural effusion, ascites. All these things are possible in bryonia. Okay. So here again you see serous membrane, it will cause effusion. Mucous membrane, it will cause inflammation. Okay. Excoriating mucoria. What is mucoria? Excess mucus secretion. In sulfur, you will see excess mucus secretion, and those mucus secretions are excoriating. Now, how do you apply this into the materia medica? How do you apply the knowledge of sphere of action into materia medica? Simple. When I am talking of nose tomorrow, what will I tell you? Sulfur it is acrid, meaning our mucous membrane is thin. So you see all that reddish wound happening because of this excoriating discharge. Any confusion? So what was the first area you saw in sulphur? Severe affection? Pains. Second? Total pains. Good. Third? Circulation. Severe affection. Fourth? Lymphatics. Very good. Fifth? Skin. Sixth? Serous membrane. Seventh? Mucous membrane. Okay, so you see how deep I think it is. Not any area is spared by sulphur. Male genitalia, female genitalia, every part you see sulphur acting. Important. Okay. So we'll go ahead. Now this is, what is this? What is this? Ailments from. What are the causative factors? See, ailments from andre causation. Each remedy has its own causative factors. Starting from ledum, we started, till calcarea. Every remedy has its own causative factor. Now what are the causative factors in sulphur? So like for example, if you just see here, ailments from fall. You know many remedies by now. Ailments from fall, hypericum, arnica, symphytum. But you know which fall? What is the result of the fall is very, very important. Okay? Now for example, we had graduation day, one of our friend had message, her friend had fallen from the bike, okay, and his tailbone, what is tailbone? Coccyx, that is injured. What is the remedy? Very good, beautiful, hypericum. There we don't think ailments from fall and don't give arnica. You are getting my point? See, this is how you apply what you have studied in classroom into the practice. So he had a fall, he fell down and his coccyx is injured, it is fractured. A beautiful remedy will be hypericum. Hypericum, okay? So ailments from fall and ailments from injuries, blows, ligament tears. A better remedy for ligament tear, a better remedy for ligament injuries. Restores, good, restores. Restores, rota, of course sulphur. Okay. Fall, blows, sprains. Ailments from fall, blows, sprains. Many injury remedies you have, you can also think of sulphur. Okay. Yeah, this is what we thought. We just have a small recall. Injuries to the periosteum and tendons. Must be good, very good. Okay. Second, a remedy for puncture injury. Yeah. Okay. For kind of injuries, one thinks of restores. See, restores mainly for ligaments, not ligament. A remedy for sprain, ligament injury. You know, you're walking, you slip, you sprain, you have a swelling, and restores can be a beautiful remedy. Arnica? Brain injuries, good. Good, brain injuries. Injuries for bones and cartilages. Very good. See, this all can be MCQs. This all can be MCQs. So ailments from blows is what we saw. Ailments which also comes from exposure to sun. One more remedy. Ailments from getting overheated, exposure to sun. See, restaurants is exactly opposite. Restaurants, they feel better getting exposed to sun. When I say exactly opposite, the remedy comes to mind is bryonia. Ailments from getting overheated, getting exposed to sun is bryonia. In brackets, please have bryonia. Anywhere you your notes. This is very important. Important in sulphur. Sulphur is a skin remedy and many times skin eruptions which are suppressed and then they land up with problems. Any other remedies you would like to put in brackets? Cilicia? Okay, cilicia, bryonia and ailments from alcohol. In brackets, the first remedy is okay, and ailments from strain, and the child or the patient is trying to reach high. Very good. One more remedy is rest. Good. Keep it up. Rest. Okay. And ailments from bed sores, injuries which are not healing. Bed sores. Okay. Bed sores, we have beautiful cases. Must be when time permits. I'll share cases. Now, two components or two objectives we have finished by now. What is the first objective we have taken? Sphere of action. Any quick questions in sphere of action? Boys? Any quick questions? Sphere of action means where exactly or which part sulfur is acting. That is sphere of action. Okay. Second component we spoke was ailments from. Any quick questions? All clear? All of you? Okay. We look at the third very important thing. Now what is this? What is this? How sulfur looks physically. What is it called? Physical constitution or physical appearance of sulfur. Okay. Any other remedies that you can quickly recall which had physical appearance? Arnica, Ruta, Restox. They did not have any physical appearance. Very good. Arnica had. Silesia had. Brayoni has. Yes, good. Agreed. And calcarea has. Calcarea card. But the madam should start. Calcarea has a typical physical appearance. The moment you see the physical appearance, you think, see this is calcarea, see this is barita. Okay, so that is the typical look a person has. Now what is the typical look sulfur has? So I don't want to discuss barita, silesia because we don't have so much of time. It's our plan, we can't exceed the time limits given by CBDC. So I assume you all know that because how is Bray? How is Bray physically to look? They are very robust, very strong, rigid muscles. Okay? And calcarea? Fair. See, there are 3 F's that will tell you about calcarea physical appearance. Fair, fat, flabby. They look very fair, they are fat and loose. They are flabby. That is calcarea. Barita, you know, dark, physically and mentally. Very short, dull look, thick lips, protruded tongue, vacant appearance. Many of you have written this in your exams. Vacant appearance, fine, Barita. Silesia? No, I'm talking about physical appearance. They are lean, thin, open continence, pot belly development. They are talking of kids. They can be silicious. Now, how is sulfur? See, sulfur is one constitution. Many of you, the moment you look, you can identify. Now, what is that uniqueness you have in sulfur? Okay, one, they are very lean, they are very thin. A beautiful word I want to use here is, they are dirty. And it's not a beautiful word, must be, you expected something really beautiful. But this is the word that denotes sulfur appearance. They are very dirty. We have many patients coming to clinic. Okay, if you want me to be more practical with examples, you know, they would have drank soup, they would have eaten food, stains will be there on the dress. They would have just walked in to the clinic. Okay, done. And even if they wear something matching, so I'll talk to you under mind. It's beautiful. I'll give you examples. We'll explore more under mind. So accordingly, let the surface be there. What I want you to understand is, I have cases, I'll discuss cases. Suited to dirty, filthy people who are prone to skin affections. One, lean, thin, stoop shoulder. What do you understand by stoop shoulder? Many times you'll be seeing people walking like this. When I know you might be getting many actors in your mind, but anyway, do not take the names, but please understand, this is how they were walking. The lean, thin, tall, but shoulders will be stoop. Stoop shoulders who walk and sit stooping, walk stooping like old man. Okay? Body offensive. See, this is what I want you to understand. body odor won't have gone. Or the body odor for time being is being washed out. But it is there because it is sulphur. You know, child looks strange. A little old man, big head, big belly with emaciated limbs. This is how they are. And it is very important you remember this. Because sulphur is a remedy. I will not be repeating again unless you come for your PG classes. Okay? So, in the limited time, I want to give you the best picture of sulphur. Hope I am clear. Sulphur, that is physical appearance, how they look. Okay? So, now this is what is very important. Mother would have just given him bath 3 minutes, 4 minutes back, and sulphur will not waste even a single minute to get dirty. Okay, so this is how they are. Okay, we will discuss more on the mind. So 3 things I am again repeating so that you are in connect with what I am trying to explain. First thing, what is purpose? Introduction, sphere of action, ailments from how they look, physical appearance. And the last part of today's class will be characteristic symptoms. What is characteristic? What is peculiar in sulphur is what we will try to explore. And this is very important. This is very, very important. Okay? See, when a patient, sulphur patient comes to our clinic, or when any patient comes to our clinic, they give us lot of symptoms. All symptoms will not be peculiar. Okay? And we homeopaths will be waiting to take only what is required. What is required. Right? So what is it that is peculiar in sulphur? Why did I give you the example of crackers? Sulphur is used in many industries, many places. But why exactly I gave you the example that sulphur is used in crackers is sulphur, in chlorine or in clinics we have seen, sulphur is a beautiful remedy for burning pains. What is it? Sulphur is a beautiful remedy for burning. What did I tell you? A typical sulphur patient tells, sir, मेरे तल में मेरे हाथ जलते हैं sir, जलन, burning. So burning of palms, burning of soles, burning of tongue, burning of lips, burning in the anus, burning in the spine. You see many areas where you see burning like fire. Sir, जलन ऐसा है कि आग fire. कहाँ है आग? All around areas. Fine, इधर है आग. Fine. So burning like fire. Hope you are imagining all these areas if there is fire. If there is burning like fire, it's a very troublesome thing for the patient. I also want to bring to your notice, there is one great author by name E.B. Nash. I don't know if you have gone through his book, small book. He is one man who talks of trios. After class, please go to library and see who this great man is. Leaders of Homeopathic Material Medica. This is a small book by E.B. Nash. In the last few pages, he mentions trios. And they can be your Viva questions. Okay? So what I want you to understand here is, out of so many homeopathic medicines, Dr. Nash takes 3 top remedies and he says trios of burners. So there are so many remedies in your Materia Medica which can bring burning pains. But sulphur is among those top 3 remedies. A small assignment for you, which are the other 2. Please have a look and let me know in the next class. So trios of burners, first point, important. And second thing is, what do you see from the image? Is angry or hungry? Hungry, good. I read it as angry. I am not seeing anger. He is hungry. In hunger, in sulphur, organ sensation will be at 11. If you have sulphur, 11 a.m. you feel hungry. Class is going on. Material class, 11 o'clock. Sir, please, hunger. So hunger at 11, very, very characteristic. emptygon or faint feeling in the stomach about 11 a.m. better by eating. Very characteristic. So please remember, very important. What is the next slide that we are going to discuss? Sweets, good. Why sweets have come up here? It could be aversion or it could be desire. Good. Don't conclude aversion. In sulphur it is desires. Desire sweets. Desires alcohol. Where did you see alcohol in sulphur a little while ago? Alcohol was an ailment. Alcohol was a causation. Sulphur also likes alcohol. Desires alcohol. Okay? And they also like sour things. Sour. Huli, katta. Sulphur ko katta both pasand hai. Okay? Katta, and they also like cold things, chill things, refreshing things, coke, juice, etc. Okay? Now, what is this? This is aversion. Very good. This is aversion. Aversion to what? Milk. Good. Aversion to milk. And second important thing you also see is sulphur also hates meat. Meat. Okay? And sulphur does not like eggs. Okay? So hope this slide is clear. They love sweets. They love alcohol, refreshing things, cold things, and they also like sour things. And what they not like, it could be egg, it could be meat, or it could be milk. Which is the remedy which likes cold milk? Very good. Restox. Desires cold milk. Restox. Okay, good. So we'll come back. We'll continue. Very important. I want few remedies here. Constipation. As a first year student, what remedies come to your mind when you see this image? Very good. Good. Salisha. Good. Kya hai Salisha? How is it in Salisha? Very good. Hard. Naughty. Stools are so hard. Or obstinate constipation. The stools have to be removed mechanically. Stools have to be removed mechanically. Very good. One more point. Salisha. Very good. It comes out and goes in. What is the word I used? Very good. Good. I am happy with the word. Receding stools. Comes and goes back. Very good. One is Salisha. Any other remedies for constipation? Constipation again. One more remedy. Or Salisha is there. Something you would like to contribute. Good. Arnika. Again is Arnika. Good. Arnika, your friend says, the stools are ribbon. Good. Or one word, flat stools. Ribbon. Very good. Arnika. Any other remedy? Very good. Bryonia is there. How is it in Bryonia? Bryonia. The nickname of Bryonia is Dryonia. So why there is constipation in Bryonia? Acting on the mucous membrane, it causes dryness. So stools in Bryonia, dry, hard, as if burnt means what? Hardly any moisture. It is dry, hard, as if burnt. Bryonia. Very good. So Bryonia into Arnica into Salisha. Any other remedy for constipation? Ruta. Very good. Ruta is there. Mucus. Okay. Very good. Ruta can also have prolapse. Rectal prolapse. Ruta can also have rectal prolapse. Okay, good. Very good. See, this is how we remember other remedies also and we don't forget. Good. So, sulphur is there. What is the character of stools in sulphur? See, these are the questions that will come up in your viva. Please focus, concentrate. And otherwise tomorrow you will be putting up a very bad face in front of the examiner. And I want my students to be confident when answering. Don't give room for an examiner to comment about your performance. Please give your 100%. Okay? So stools hard, naughty, dry as if burnt. stools, painful stools. See how nicely Dr. Allen in his keynotes he gives. I have some 6-7 cases cured only on this particular line. And what is that line? Child is afraid to have the stool on account of pain. Naturally, stool is large, it is dry, hard. So, child is afraid to go past stools because it's very painful. So, child holds, child resists, child cries, Amma, I am not going. I am getting stools, if I go, it's very painful. And it starts weeping. I have 5-6 children who have been beautifully benefited with sulphur. A dose of sulphur and these are all normal events, physiological events. Nobody should cry for this. The physiology, normal events happening. And sulphur can do wonders in bringing normal motions, normal stools. Okay? And other very important symptom. Can you differentiate this and this? Huh? Very good. What do you think of diarrhea? Right? So, here you can see constipation, here you see more of diarrhea. And diarrhea also in sulphur is very, very characteristic. What remedies for diarrhea? From the list we have done. Remedies for diarrhea. Okay, restores. Good. Then. Bryonia also has diarrhea. Early morning diarrhea. What is the character in bryonia? Early morning. When early morning? The first moment in bryonia. When you are getting up in the morning, you have to rest. You are just, stretching, and that moment is enough. And he has to rest. Bryonia. Early morning diarrhea. You also have early morning diarrhea. Diarrhea, painless. You understand? Constipation, painful. Diarrhea, painless, driving him out of bed early in the morning. Early morning diarrhea, the urge wakes him up. The urge wakes him up. Okay? He is deep asleep and he gets an urge and he has to rest. Or anytime when he is getting up, he gets up with an urge. Today is Sunday, let me sleep till 11. Okay, till 11 is sleeping. But 11, he gets up with an urge. It's not like bryonia. Bryonia, what did I tell you? The first moment in bryonia can bring on diarrhea. Early morning diarrhea. Again epicurus, again MCQ. You should be careful. And we also saw sulphur is a beautiful remedy acting on skin. And I told you it can cause various complaints. Ulcers, eczema, even bed sores, any damn thing, you name it, we have it in sulphur. So what I also want you to understand is the discharges. The discharges in sulphur will be offensive, very important. Bad smelling. Okay. Acrid. From the wound, from the injury, from the ulcer, or generally his body odor is offensive. His body odor is offensive. Okay? Now this is very, very important. What is this? Under sphere of action I told you, irregular circulation of blood or irregular distribution of blood. So this is what causes, I told you, what was it? The scalp becomes very hot. Hot flushes, rush of blood to the head, chest, congestion of the parts, red lips, red anus, red urinary bladders, red vulva. It is not red, it is because of congestion. It is because of congestion. It is because of congestion. Okay? Must be this is the last characteristic, though you might have many more. I am giving you what is important. The last characteristic symptom here is sulphur is a person who cannot stand. Standing is the worst position for sulphur. Now, what did you understand from this statement? No, he cannot stand. For example, if I am sulphur teacher, what will I do? I will pull a chair. I will pull a chair. I might sit and I will start dictating or I will start taking class. Right? Okay? For sulfur, standing is the worst position. They can't stand. Every standing position is uncomfortable. Every standing position is uncomfortable. Okay? So we'll quickly have a recall of what we did and we'll end the class. Hope this object is clear. What do you think? This object is clear. So where did you see sulfur acting? Veins, very good. Good. Circulation, good. Portal system. Lymphatics. Or one word what you can put in before you start is, it is a deep acting remedy. It acts on every part of your body. Predominantly, it acts on whatever you are trying to do. Veins, circulation, nerves, what is it, lymphatics, skin, mucous membrane, serous membrane, male, female, everywhere. You see, sulfur acting. Ailments, fog, blue, spring, first step. Second step, very good, sun, alcohol, bed sores, suppressed eruptions. Stretching, yes. Okay, sorry, reaching height. And then in the bargain, some ligament, something gets sprained, something gets strained. You can think of sulfur. Okay, good. And third thing we saw was, how do they look physically? They look generally lean, thin, dirty, good, and stone shoulder. Okay, very dirty people, they cannot stand. All those things, fine. And characteristic symptoms, we started with burning, trios of burners. What is it? Trios of burners, and then we also saw that hunger at 11 a.m. Periodicity, hunger at 11 a.m. We saw desires, we saw aversions, and we also saw that they can't stand. What is the discharges like in sulfur? Discharges are acrid, more than acrid, offensive, very stinking, bad smelling. Okay, offensive discharges. And then we also saw that, constipation, diarrhea character, only one, wakes the patient, and it is painless. Okay, then, anything else? Okay, so these are few things. Hope I am clear. Next class, we will look at a very important part, and that is mind. And before you come for the next class, please read sulphur in Kent's Material Medical. What is it? What do you remember? Sulphur in Kent's Material Medical. And if you read from Kent's, you will never forget. Please read, and it will be easy for me to continue. And we will try to take up mind, and if time permits, some particular symptoms. So assignment for